Good morning, everyone. In this session, we will discuss patient monitoring systems, which are essential devices used in hospitals to continuously observe a patient's vital signs. For students of electromedical technology, understanding how patient monitoring systems work is critical, as these devices play a key role in patient safety and clinical decision-making. A patient monitoring system is a medical device designed to measure, display, and record physiological parameters in real time. These parameters typically include heart rate, electrocardiogram or ECG, blood pressure, oxygen saturation, respiratory rate, and body temperature. By monitoring these values continuously, healthcare professionals can quickly detect changes in a patient's condition and respond appropriately. Patient monitors are commonly used in areas such as intensive care units, emergency departments, operating rooms, and recovery wards. In these environments, patients often require close observation because their conditions may change rapidly. Unlike single-function devices, patient monitoring systems integrate multiple measurements into one centralized unit. Let us begin by discussing the basic components of a patient monitoring system. A typical system consists of sensors, cables, a processing unit, a display, alarms, and a power supply. Each component has a specific function, and all components must work together accurately to ensure reliable monitoring. The sensors are responsible for detecting physiological signals from the patient. For example, ECG electrodes detect the electrical activity of the heart, a pulse oximeter sensor measures oxygen saturation, and a blood pressure cuff measures arterial pressure. Proper sensor placement is essential, as incorrect placement can lead to inaccurate readings or false alarms. Once the sensors detect the physiological signals, the signals are transmitted through patient cables to the monitoring unit. These cables must be in good condition to prevent signal loss or interference. Damaged cables are a common cause of monitoring errors, which is why regular inspection is an important maintenance task for electromedical technicians. Inside the monitoring unit, the signals undergo amplification and signal processing. Similar to ECG machines, patient monitors deal with very small electrical signals that must be amplified before analysis. Signal processing techniques are used to filter out noise caused by patient movement, muscle activity, or electrical interference from nearby equipment. After processing, the data is displayed on the monitor screen. The screen shows numerical values, waveforms, and trend graphs. For example, heart rate may be displayed as a number, while the ECG signal is shown as a waveform. Trend graphs allow clinicians to observe changes in vital signs over time, which can be more informative than a single measurement. One of the most important features of patient monitoring systems is the alarm system. Alarms are designed to alert medical staff when a patient's vital signs exceed preset limits. Alarms can be visual, audible, or both. While alarms are essential for patient safety, improper alarm settings can lead to alarm fatigue, where staff become desensitized due to frequent non-critical alarms. Therefore, correct alarm configuration is crucial. Patient monitoring systems can be classified into bedside monitors and central monitoring systems. Bedside monitors are located near the patient's bed and provide direct monitoring. Central monitoring systems collect data from multiple bedside monitors and display it at a central station, allowing nurses and doctors to observe several patients simultaneously. Modern patient monitors often include network connectivity. This allows patient data to be transmitted to electronic medical record systems or central monitoring stations. From a technical perspective, electromedical technicians must ensure that network connections are stable, secure, and compliant with hospital standards. Electrical safety is a major concern in patient monitoring systems because the devices are connected directly to patients for extended periods. These systems are designed with isolation circuits and low leakage current to minimize the risk of electric shock. Routine safety testing is required to verify that the monitor meets safety standards. Maintenance and calibration are essential to ensure accurate patient monitoring. Preventive maintenance includes checking sensors, cables, displays, alarms, and batteries. Calibration ensures that measured values, such as blood pressure and oxygen saturation, remain accurate. Failure to maintain and calibrate patient monitors can result in incorrect clinical decisions. From the perspective of an electromedical technician, your responsibilities include installation, inspection, troubleshooting, and user support. You may be asked to assist nurses in resolving sensor errors, alarm issues, or display problems. Effective communication skills are therefore just as important as technical knowledge. In addition, patient monitoring systems must be reliable during power interruptions. For this reason, most monitors are equipped with internal batteries that allow continued operation for a limited time. Technicians must regularly check battery condition and replacement schedules. In conclusion, patient monitoring systems are vital medical devices that continuously track a patient's physiological condition. By integrating multiple sensors, advanced signal processing, and alarm systems, these devices support timely clinical intervention. For students of electromedical technology, understanding how patient monitoring systems work, how to maintain them, and how to support clinical users is a fundamental professional skill. Thank you for your attention. I hope this session helps you develop a clear understanding of patient monitoring systems and prepares you for practical work in hospital environments. 11. What problem can occur if alarms are not properly configured? A. Signal amplification failure. B. Alarm fatigue. C. Network disconnection. D. Battery overheating. 12. What is the difference between bedside and central monitoring systems? A. Central monitors are used only in ICUs. B. Bedside monitors cannot display waveforms. C. Central systems monitor multiple patients at one location. D. Bedside monitors do not use alarms. 13. Why is network connectivity important in modern patient monitors? A. To reduce power consumption. B. To transmit data to central systems or medical records. C. To replace sensor cables. D. To eliminate alarms. 14. Why is electrical isolation essential in patient monitoring systems? A. To improve display quality. B. To prevent electric shock. C. To increase data storage. D. To speed up signal processing. 15. According to the listening, what is one responsibility of an electromedical technician? A. Diagnosing patients. B. Prescribing treatment. C. Installing and maintaining patient monitors. D. Interpreting laboratory results. Answer the multiple choice questions based on the tape. 1. What is the main purpose of a patient monitoring system? A. To treat diseases directly. B. To continuously observe a patient's vital signs. C. To replace medical staff. D. To perform laboratory tests. 2. Which of the following is not typically monitored by a patient monitoring system? A. Heart rate. B. Oxygen saturation. C. Body temperature. D. Blood glucose level. 3. In which hospital area are patient monitors most commonly used? A. Pharmacy. B. Medical library. C. Intensive care unit. D. Administration office. 4. What is one advantage of patient monitoring systems compared to single-function devices? A. Lower cost. B. Smaller size. C. Integration of multiple measurements. D. No need for calibration. 5. What is the primary function of sensors in a patient monitoring system? A. To store patient data. B. To detect physiological signals. C. To analyze medical images. D. To display numerical values. 6. Why is correct sensor placement important? A. To increase battery life. B. To reduce alarm volume. C. To ensure accurate readings. D. To improve network speed. 7. What role do patient cables play in the monitoring system? A. They amplify signals. B. They record patient history. C. They transmit signals to the monitoring unit. D. They control alarm limits. 8. What happens to the physiological signals inside the monitoring unit? A. They are deleted after display. B. They are amplified and processed. C. They are converted into images. D. They are stored without modification. 9. What information can trend graphs provide? A. Instant diagnosis. B. Changes in vital signs over time. C. Battery status only. D. Alarm volume levels. 10. What is the main function of the alarm system? A. To store patient data. B. To improve image resolution. C. To alert staff to abnormal vital signs. D. To control sensor placement. 11. What problem can occur if alarms are not properly configured? A. Signal amplification failure. B. Alarm fatigue. C. Network disconnection. D. Battery overheating. 12. What is the difference between bedside and central monitoring systems? A. Central monitors are used only in ICUs. B. Bedside monitors